Hi everyone, Dr. Chelsea here with Treasure Valley Pelvic Health, and today I'm going to be talking about pelvic floor, also known as pelvic health physical therapy. I'm going to go through what's involved in an exam as well as follow-up treatment, and why all women should have at least a couple sessions of pelvic floor physical therapy. So keep watching and learn more about this underutilized area of care. Now, one of the most common questions that I get when asked about what I do for a living is, what is pelvic floor physical therapy? It's one of these areas of care that most people have never heard about and are really surprised that there is this sort of treatment available. So the pelvic floor itself is this group of muscles that lines the bowl of the pelvis, right? So it creates kind of a hammock within the bowl of the pelvis, as well as creates closure to the opening of the vagina, the opening of the urethra where we urinate from, as well as the anal sphincter. So follow the other video when I dive through all of the functions of the pelvic floor specifically in a lot more detail. But in general, someone who has problems to the pelvic floor, commonly called pelvic floor dysfunction, will have problems with bowel, bladder, digestive dysfunctions, as well as pain in the pelvis, which may be pain with intercourse. It may be difficulties or pain with bowel movements, or even chronic hip and back pain. Even sometimes it goes all the way down to the foot and ankle, as well as all the way up to the head and neck. So you really have to look and have someone who's going to look at the body as a whole, not just the pelvic floor. The really frustrating thing about all of these symptoms is that so many people in our society, providers included, feel that these are normal things for someone to experience. And though you're going to hear many pelvic floor therapists say things are common but not normal, you really have to be your own advocate when you're struggling with this, because sometimes your providers don't know or haven't been educated in the role that pelvic floor therapy may take in alleviating some of these symptoms. So why should someone see a therapist if they're not having symptoms? First of all, it's really important to know what your baseline function is. If someone struggles to contract the muscles, i.e. do a Kegel, then over time, they may not be having any symptoms right now, but when they get older, as our muscles decrease in quality and quantity in the muscle fibers, then you're going to create this threshold or reach this threshold where you're going to tend to have more symptoms. So just because you're not experiencing symptoms doesn't mean that you don't have an imbalance in the system. It simply means that you're below that threshold of symptoms. So what exactly is involved in a pelvic floor exam? I believe it's really important to start by looking at posture, the mobility of the abdominal organs, as well as working your way towards the more specific of the pelvic floor itself. So when I look at the mobility of the abdominal organs, I want to see that there aren't restrictions in side to side, up and down, and even just a little bit of rotational movement. Restrictions in the abdomen really play into restrictions in the pelvic floor. Even if someone doesn't have pain, maybe there's tightness from scar tissue, perhaps from a cesarean, or maybe from a appendectomy or a gallbladder, a cholecystectomy, right? There still creates a line of tension. And if there's restriction, then it can create this tension down below. And maybe it then doesn't allow the muscles to contract as efficiently. So we have to release that tension so then the muscles can really be at a truly relaxed position. And then if we start working on specific strengthening, more so Kegels, then we want to get that good contract, relax, open. We want to make sure we have full range of motion. So we really want to also then shift down and look at the external area of the vulva. And before we proceed to an internal exam, we want to look at the health of the tissues here at the vulva, at the opening of the vagina too. There can be many skin disorders that may be present. There might be areas of an ingrown hair that creates just pain and tenderness. So really deciphering all these little nuances. And of course, we want to just kind of observe and check the quality and vibrancy of the tissue itself, as well as the discharge. A discharge should never be foul smelling. It shouldn't be really thick. And oftentimes there can be underlying reasons behind that. It might be a yeast infection, it might be something else. So it's really important to get a good, clear visual of the tissues themselves. Then I have someone do a Kegel. I don't really explain what a Kegel is outside of trying to hold back gas or stop the flow of urine if they're not familiar. But I want to see to them, what does that mean? How are they functioning in their day-to-day life and their day-to-day functions, right? So I really want to see the muscles of what we call the perineum, again, the area of the vulva. As you do a Kegel, I want to see that tissue kind of lift up, and then I want to see that it relaxes. It's also important, like I said just a moment ago, to be able to fully relax and kind of bulge or open. This can be important for not only for bowel movements, but also for emptying the bladder and childbirth, right? We have to open those muscles completely in order for a baby to descend through that vaginal canal. Then I proceed with the internal exam. And with the internal exam, I don't use a speculum. It's just a single gloved finger, and we're just gently touching upon each muscle through the pelvis. Now there's 3 layers to the pelvic floor, and so we want to look at each muscle in each layer and not only compare layer to layer the mobility of the tissues and the tension of the tissues, but also it's important to assess side to side. They're pairs of muscles. So we have essentially, just like we have a right rotator cuff and a left rotator cuff, we have a group of muscles on the right side that are just paired and same as that on the left side of the pelvic floor. And there might be an injury, a back injury, a trauma that occurred, or a trauma from birth that might create a little bit of increase in tension to these areas. So we really want to know what's tight and where exactly that is, so that we can get a clearer picture on how to proceed with treatment, right? As I mentioned, there are oftentimes associated restrictions in the abdomen and the pelvic floor. So even though the area of complaint might be the back or maybe the groin or the abdomen, it doesn't always mean that that's going to be the root cause. So it's really important to do a whole body assessment, as I mentioned, but really be able to decipher what is the root of it. It's not just how do we decrease the symptoms, but what is the root cause of the symptoms themselves? Is it weakness? Is it an overdrive in the nervous system, being in more what we call a sympathetic overdrive, a stress response? Or is there a neurological problem where the nerve is irritated and painful, or weak and not communicating as clearly to the muscles? So it's really important to get to that root cause. Now, as I'm working through the pelvic floor exam, sometimes a question will come up, whether it be before the assessment or during the assessment. The exam should never be painful. Yes, we want to find the areas of tightness, and though it might create a little discomfort and sometimes pain, I immediately work to release that and create a change. If we're not getting a change, an improvement in that discomfort or pain, then we need to change on how we're creating a communication response from the area I'm touching upon to the tissues that I'm trying to manipulate. Like I said, there's often an association between the tissues of the abdomen. I work a lot with the association of the uterus into the pelvic floor and getting that to release, so then the muscles can let go and it decreases the pain or the sense of tightness. And the tricky thing is that there may not be symptoms of pain or discomfort, but there might be tightness, right? So sometimes imagine that if somebody walks behind you and puts their hands on your shoulders oftentimes will create this natural kind of drop. And so when I'm doing an internal assessment on someone, oftentimes they don't even realize that they're holding tension there. But I like to call the pelvic floor and the pelvis itself Pandora's box. This is where a lot of stress and a lot of emotion is held. And so it may not be per se symptomatic in creating pain. But if the muscles are overly tight, then they're going to have a harder time creating good contraction. for Kegels and whatnot, working towards strengthening, and you might experience something more along the lines of incontinence. Now back to the exam. If we are working in the pelvic floor, or really truly anywhere in the body for that fact, if we are continuing to touch upon areas and it creates pain, we're reinforcing that pain response into our brain, into our unconscious or subconscious mind. And so if we are trained that this activity is painful, we're going to tend to continue to avoid that or work around it or create a little bit more tension. So if when I'm doing the internal exam, we don't create a change in the sensation, an improvement in that pain, we have to readjust and try and figure out how to make that change happen. Otherwise, we need to move on. It's not going to be conducive. So although it is important to get a full picture of how all the muscles in the pelvic floor are working and functioning, it doesn't necessarily have to all be done at that one visit. We can really start to progressively work a little bit deeper and through each muscle layer depending on how the person responds. Now, if they don't have pain, it's just a little bit of tightness or no tightness at all, great, we can work through that exam rather quickly. But if there's pain, it's so important to take time and not create a stress response for that patient who's getting the exam so that they don't create and reinforce that pain response in their body. Once I get through all of the muscles of the pelvic floor and can at least touch upon them and get an idea of if it's tender or tight or totally fine, then we can work on how does that person contract, relax, and open, right? We want to see how the muscles move. I want to feel how the muscles move. Now, one thing, before I even do an internal part of the exam, I'll have a person do a Kegel, like I said, and I want to see how those muscles or that perineum moves, recall? Then when I insert my finger and I'm feeling, it might show me a totally different pattern of movement. They might create just more of a gripping pattern, or are they actually getting a lift? I've even felt where someone thought they were getting a lift doing a Kegel, but they were actually pushing. So you never really know unless you're feeling it. And I'm a big believer that you have to feel it to be able to get a clear picture of what's going on in the pelvic floor. Now, just because someone experiences weakness and we recognize they have that sense of weakness or difficulty getting a good contraction in the pelvic floor, doesn't mean that they don't have tightness. Oftentimes, a tight muscle is weak. So that's why it's important, even though it may not be painful, it's important for us to fully get that muscle to relax and lengthen so that when we get a contraction and start working on strengthening, we can utilize the full range of motion of that muscle. From all of this, I'm really trying to gather what are all of the key contributing factors to a person's symptoms. There are so many times there might be more going on than what the person realizes. The most common example of this might be that someone comes in experiencing urinary incontinence or leakage, and then hearing through their history that they have a history of chronic constipation. And there's so much of a correlation between the pressure created from constipation that pushes forward into the bladder that it creates an overstress of what the pelvic floor can hold and what that sphincter of the urethra can really restrict, right? So then they might be more prone to that. So you have to look at not only the area of complaint, but the person as a whole. How is their digestion? How is their scar tissue mobility from their cesarean 20 years ago or their appendectomy site, right? So you have to really decipher all of that. Oftentimes, there's even a really strong correlation to the foot and ankle and the pelvic floor. So it's important to look at that as well as into the spine and the pelvic floor because the nerves come out of the spine and go to the pelvic floor. So it's important, again, to treat the body as a whole, look at it as a whole, and not get honed in on one area. I often get the question, is it necessary to have an internal exam, an internal assessment? And though we can gather a lot of information by just observing and feeling externally, or the use of biofeedback or surface electrodes, that can be helpful, but to get, again, the clearest picture, I have found in my clinical practice to feel the muscles and the movement of all the tissues, not only internally, but also in the abdomen. and you don't know what that response is unless you're able to feel it. Biofeedback can be a great tool for some people. However, I've found that it can be a little bit more finicky and more challenging to catch the nuances of if a person's contracting the whole pelvic floor or are they just getting the backside. For me, I've felt more quality results with the internal exam versus working with a biofeedback machine. Now, obviously, follow-up treatments are going to be tailored to the specific needs of the findings that we find in that initial exam. There should never really be a cookie cutter approach to someone's treatment. We want to really hone in on the root cause, as I'm hammering down repeatedly, right? We want to get to the root cause, the why of that symptom. If we're working on strengthening, I get really particular. I want someone to be able to do the very, very basic movements, even if they may seem extremely fit. I take them through the exact same beginning steps to make sure that they are properly isolating all those muscles so that as they work to more advanced levels, they're not continuing those compensatory patterns that they're used to working in, but rather pulling back and learning how to redo the basics, right? Growing up, I played piano, so you'd have to do your warm-up and do your scales and all these couple little details to do a warm-up before you got into practicing your new song or your sport or whatever it is, right? So it really needs to be tailored and it really needs to be done correctly. Now, if we're working in towards tightness, whether or not pain is present, it's important to really get to that root cause, the deeper reason of those symptoms. Like I mentioned earlier, is it that you are tending to be more of an anxious individual and maybe more stressed out, so you tend to be a little bit more tense, right? Is there some strategies that we can use to create a shift in that and calm the nervous system so that we can in turn to calm down the tension in the muscles and ease your symptoms? It is not effective to just force change, to just try and manually stretch or to use a dilator without any other adjunct care in order to get long-lasting results. You can't force a muscle to relax. You got to convince and work with the system, the nervous system specifically, in getting the tissues to really let go effectively. Now, the frequency of treatment, again, is going to depend purely on the findings of that initial exam and the goals of that patient, right? So I tend to see my patients once every 2 to 3 weeks, though it's common for some other pelvic health practices to see patients once a week. It just depends on that provider's philosophy and how they approach working with the body. I coach my patients to be able to do a few exercises or a few things to help facilitate that movement in the tissues, the strengthening, some pieces of homework, if you will, between each session so that we are starting at a little bit ahead from where we left off at the prior visit. Now, a little bit or a lot, I never know, but it really depends on consistency as well as making sure that we're targeting the right areas of treatment, right? So it's so important for patients to take an active role in this part of care because I can be your biggest cheerleader, but if you can't work through the little homework steps, then you're not going to get the lasting results that you're looking for. The total number of sessions, again, are going to vary depending on what we're working on. For people who are working a little bit more towards strengthening and regaining strength and stability in the system, let's say after a pregnancy or just through aging, then the average number of visits that I see someone for is between 4 to 6 visits. Again, they're spaced out once every 2 to 3 weeks, and as you improve in your strength and function, I want to give you more time to really be prepared for that next level of exercise or activity that we're going to integrate. If we're working with pain, then I might see someone once a week for a few weeks to start to get a little momentum. And as we start to see change, then I tend to spread that out. It just depends on, again, what exactly is going on. For someone with a complex pain syndrome, I might see them 10 to 12 times, but again, it's going to be just dependent on the person's goals and how they're presenting at that time. Now, I believe it is so important for us to constantly be reassessing to make sure that we are heading the right direction. I fully expect all patients to be seeing some improvements within 3 to 5 visits. If we're not, we want to step it back to the basics, talk through every angle of care, make sure we're not missing a piece of the puzzle. And there are times that maybe we need to pull in maybe some adjunct care. It might be working with acupuncture, a nutritionist, a holistic physician, or naturopath. There's so many different angles and facets of care that need to be addressed. And if it's outside of your scope of practice or outside of your skill set, don't be afraid to refer out if you're a therapist. And if you're a patient, don't be afraid to ask about other care. What are we missing? There you have it, folks. Hopefully you have a better understanding of what exactly pelvic health or pelvic floor physical therapy is and what it entails, and why it's important for you to have at least a visit or two, get a baseline understanding of what your function is if you're not having any symptoms, or if you've had a kiddo, why it's so important for all women to have a degree of care after having a baby. If you have questions what care might look like for you, you're interested in a phone consultation, or have other questions, always feel free to give us a call or email us. We're here to help you. Make sure and subscribe to my channel so that you catch the latest videos each week, and make sure to share with your girlfriends and your friends and spread the word about pelvic health therapy. See you next time.